If I take a single drop of body fluid and put it on the right growth medium, I can watch an invisible world reveal itself. Media is just food for microbes. Like we can analyze here how a media helps in growth of microbes. For example, like blood agar shows hemolysis how bacteria break red cells. McConkey agar media select for gram negative bacteria and lactose fermenting bacteria are identified as pink colonies or red colonies. Chocolate agar acts as a media for growth of difficult to grow fastidious bacteria like Haemophilus and Neisseria. Sabourode dextrose agar inhibits the bacteria and favors growth of fungi such as molds and yeast. Broths boost low count infections. Now, let's know the various fluids which can be the media for growth of microbes when there is change in the fluids. Let's list out one by one. The urine, the cerebrospinal fluid, the sputum, pleural, and as acidic fluids, synovial fluid, even bile. Each tells a different story. Blood cultures are about time to positivity. If we see a culture 10 hours versus 30 hours suggests different bacterial loads. Then gram stain showing purple rods or pink cocci instantly narrow the suspects. The antibiogram maps which medicines actually work. Urine is about numbers and context. More than 100,000 CFU per milliliter, especially with a single organism like E. coli that turns McConkey pink, strongly supports a urinary infection. Lower counts might still matter if there are symptoms or a catheter. Microbes in CSF is an urgency, which shows turbid fluid, high neutrophils, low glucose, high protein, and rapid bacterial growth point to meningitis is critical and hospital level care is required. In sputum, if too many squamous cells are spotted, it means spit and not allowing it to settle in lung. A good sample with heavy growth of Streptococcus pneumoniae aligns with lobar pneumonia. Mixed flora might be contamination. So what does this lab reality mean for Unani medicine? Blood, flame, yellow bile, black bile, and Mizaj, the body's temperament. Illness often reflects corruption of humors and putrefactive change. That language emerged before microbes were seen, but the observations are surprisingly compatible with what cultures show. When urine cultures reveal robust bacterial growth, the lab is quantifying an external agent driving internal imbalance. A Unani lens might read the same case as Balgami dominance, cold and moist, favoring stagnation and infection in the urinary tract. The modern metric CFU divided by ml and antibiogram answers how much and what works, while Unani asks why this terrain, guiding moderation in Mizaj, the correction of temperament. In respiratory infections, a culture that grows a capsulated pneumococcus alongside fever and productive cough maps onto heat and moisture excess. Unani would support evacuation like use of expectorants and addition regimental therapies like steam and rest, while modern data ensures we target the pathogen and resistance pattern precisely. For bloodstream infections, rapid positivity plus a gram-negative rod steers urgent antibiotics. Unani inference focuses on purifying and restoring humoral balance, blood purifying concepts once the acute threat is controlled. The lab defines the invader, Unani optimizes the host. Here's the bridge I use. Identify the microbe and load culture, gram, CFU, time to positivity. Match therapy to data, follow the antibiogram, avoid unnecessary drugs. Layer Unani reasoning is the internal environment cold and moist or hot and moist. Choose diet, sleep, stress, and safe herbal agents that counter that Mizaj under expert supervision. Proper data first prevents harm, tradition personalizes recovery. Neither replaces the other. Cultures stop guesswork. Unani reframes convalescence and resilience, so that single drop on a plate is more than a lab trick. It's a map from invisible microbes to measurable signals and a way to align evidence-based treatment with the Unani goal of restoring balance. Respect the data, respect the person, and use both to get back to health faster and safer. That's all in this video. Thanks for watching.